Evening, everybody. So I'm going to talk about the nurse's responsibility in general, not in specific, because most of the speakers have spoken the specific uh, management part of it and with related to that particular diseases. So I just wanted to run now because everybody is waiting to move from here. Anyway, so with the launch of a new Government of India initiative, Ayushman Bharat, the envisage conversion of all sub-center into health and wellness center. The role of nursing professional in primary health care will be undergoing paradigm shift. So we see here, because of the Ayushman Bharat introduction, so a lot of changes have come in health system, because the sub centers are being converted into health and wellness center, and where you all know that the CHO will be the head of that particular health center, especially at the sub center level. Okay, if it is at a PHC level, of course, the medical officer will be available. And if it is in sub center, the CHOs, community health officers will be available, and the courses are running. And our PG also is a that course. So nurses are approximately 2/3 of the population of health workforce in India. You all know that. And nurses' scope of work has widened with the additional roles and responsibility due to shift of the pattern of the burden of disease, especially with regard to this lot of zoonotic diseases. And one burning issue which we are seeing in front of us is pandemic. Okay, that is COVID pandemic. And emergency of zoonotic infection disease has further enlarge the responsibilities of nurses, and nursing care is the backbone of health system, as you all know. The role of nurses in primary health care, especially I'm going to talk about the preventive aspects of it. Okay, so because more than curative, the preventive aspect of care is very important, because most of the nurses, and especially been concentrated now, healthcare delivery system also is concentrated to the village areas, okay, and grassroots areas, where a lot of problems are existing, and where 80% of the population are living in semi-urban and rural areas. Okay, only 20% population are staying in the urban areas, where 80% of the healthcare facilities are available. So that's why the government has taken an initiation that health for all by 2080. So that has again extended to now the next till 30th, 2030 also. So many goals are there. I'm not going to discuss all these things. So here it includes the promotion of health and the prevention of illness and the care of ill and disabled and dying. So there's nothing but a comprehensive care has to be given by the community health nurse, in fact. And the life expectancy at birth improved in India from 59.7 years in 1990 to 70.3 years in 2016 for females especially, and from 58.3 years to 66.9 years for males. We see that lifespan is less in men than the women, because so men are very much involved in external environment works and been with the animals, and also the prone for infection in outside world. So in Indian scenario, if you see, there are been emergency of new and re-emergence of earlier seen infection disease in more virulent form after a period of decline in or disappearance. So it disappears and again it rises up. Especially we see in 1993, I believe. So there was a outbreak of plague in North India, especially. So we were about to come from South India to North India for a tour. Because of that plague, okay, which is the carrier of that plague virus is rat. So now it is not there. Okay, so suddenly we don't know when it is going to rise up. So the role of nurse has consequently further expanded to keep the public informed about these infectious diseases and risk involved, while at the same time working towards the prevention of the spread of disease. It is very important for the community health nurses to have a proper health education programs. So I am the community health nurse specialist, Okay, and I take students to the community, and most of our students, they are come there. I think they had a very good session of health education there. So we also should give importance to these zoonotic diseases in future. Okay, so there is in Shishandi, we see that, I see that there is an veterinary hospital, government veterinary hospital. I went to the doctor and I requested him, sir, can you give a lecture for our student at least for an half an hour? Okay, sir, will give, but he could not make the time. Okay, because maybe because of negligence. I feel most of the time they used to sit quiet and they used to have nice tea and snacks and all. So they say, no, wo program hai sir, ye program hai, dekhenge aage. So that made me not to go and approach them again. So that's what we need to again motivate them and involve them. So as the main focus of this is, it is One Health. So One Health includes nurses, also doctors and veterinary scientists, okay, and the other lay people also, because they are the one living with the animals and using them for a different purpose. And auxiliary nurse, ANMs, and also LHVs and ASHAs are the grassroots level workers. We need to educate these people and supervise these people as a CHOs, community health officers. You are going to be going to take a position in future, I hope, because many opportunities are there, community based opportunities are there for the nurses. So you should strengthen these three people, three cadres. That's what I'm telling you. I'm talking in general, not in specific about it. Okay, so for that you need to have a lot of information about the zoonotic diseases. Of course, I'm not going to deal this slide because it consists of a lot of how many numbers of LHVs and ANMs are there. So time constraint, and even this also I'm going to just I wanted to mention here the people who are at risk. So very young and elderly, immunosuppressed, compromised people, and pregnant ladies, and also who have injuries more susceptible to infection, and especially the people those who are working in the farms. Okay, so farmers, they are prone to get a lot of insect bite, animal bites, and a lot of contact with the animals, and they also use the cow dung for many purposes, and it harbors a lot of microorganisms, especially Clostridium tetani, which causes tetanus, is very rich in cow dung. And they work in the field, they also get cut in their fingers and in their legs, but still they are forced to do that work because it is inevitable. And as a community health nurse, and it becomes a great responsibility for you people to go to their doorsteps and educate them about the different zoonotic diseases which are present or prevailing in the society. Okay, so again we see here sub-centers are being upgraded as health and wellness center, where very less importance is being given for the zoonotic diseases, because I take students for the visit to the sub-center, especially Jabroli sub-center we take. So there also we have a CHO, but when I heard about the responsibilities, I never heard any responsibilities towards zoonotic diseases. So that means there is a need to bring some revival in the curriculum and also in the practices. And several, this is, okay. So there are some challenges we can see. So several factors related to availability of infection disease knowledge. So it's very important. That's why we organized this session today to give some information to you people. And I'm so happy that very informative lectures were there today. And external environment, how our environment also has an impact on the zoonotic diseases is very important. And the work environment influence the effective participation of the public health force, that is nurse, in zoonosis surveillance and prevention control. The number of veterinary hospitals in India is 11,367 of March of in the March according to the March 2015, and their availability and access in rural areas very, very poor. That's what I said. Okay, so many hospitals we can see, but veterinary hospitals are very few. And here also we see veterinary Hospital, especially we see hospitals for pets, not for the other animals, only pets, that too dogs especially and cats. Okay, so we need to come out with the many such centers. I'm just uh, going ahead. And healthcare providers, physicians, clinics, and hospital generally base the information of zoonotic infection on notifiable reports. For effective surveillance, record of patient, hospital, laboratory, and death records also need to be included. Okay, so what for the deaths have happened? Okay, the cause of death also is very important. Okay, so because of that, and this review, we can anticipate how serious the zoonotic diseases in our society or community. So a dedicated epidemiological investigation to measure the morbidity and mortality impacts of specific zoonotic diseases at community level, together with their seasonality and geographical location and other risk factors need to be carried out. So collaboration between the veterinarians and health providers, nurses, policymakers, and environmentalists is a joint surveillance approach called as One Health. That's what Mr. Dikil also has discussed about that. So in conclusion, I don't want to just read this and just wanted to come to a last point and just wanted to say that, so especially as a community health nurses, make sure that, so it's very important to educate the people. Okay, education is the backbone of the health care delivery system, I can say. Okay, so make sure that the person who is handling is vaccinated, okay, against certain diseases which are available, the vaccines are available, and the animals which they are handling, they are vaccinated properly. Nowadays, if you see in the community area, so you can see the cattle with a yellow color badges in their ear. So that indicates they are vaccinated. Okay, and dogs, pet lovers, they should vaccinate their dogs periodically every year. Okay, I already told that I'm a pet lover, dog lover. I suffered a hydrated cyst. Okay, still I have a dog with me, right? So, but you should be very careful. And especially dogs, we entertain them so much, they also come and sleep with us. That's what happens. So you should be very careful. And after my surgery, so we're very cautious about it. And this is a live example for you people. And if you have a pet, anybody has a pet in your house? Yes, madam is so very careful. Yes, some students also. So with this session, I thank you for giving me this opportunity to share my thoughts. Thank you.